are here with Dr. Felicity Keough today, and I'm going to be asking Dr. Keough questions about metabolic syndrome. Okay, you up for this challenge?
Sure.
I'm so passionate about understanding more about metabolic syndrome because I believe, this is just my personal opinion, that so many of us are struggling with it and we don't realize it, and it's going to limit our lifespan. And not only our lifespan, but our quality of life. And I saw this happen to my mother and so many people in my family, and I just think it's something that we need to talk about. So I'll just tell you what I know about it. I know with metabolic syndrome, it is like a list of symptoms that you're suffering. So maybe your waistline is thicker, having problems with blood sugar, blood pressure, something else.
Well, I'm thinking more from a lab perspective of what I look for. But
Okay.
yeah, blood pressure, high inflammation is going to be another one that's going to all increase your risk for metabolic syndrome, basically. Blood sugar and inflammation being really high. The body signs and symptoms are going to be more of the weight around the midsection that just won't budge no matter how much you diet, and high blood pressure. Yeah, those are there's just a conglomeration of symptoms that go into this diagnosis of metabolic syndrome.
Yeah, okay. And if we have this combination of symptoms, they diagnose you with metabolic syndrome. And I know that because that was a diagnosis that I had prior to receiving treatment from Dr. Keough, so I no longer have that syndrome, which is great. The challenge was, had I not reversed that, my likelihood of developing heart disease, which I've been diagnosed with heart disease, but my the prognosis was diabetes, heart disease, or stroke. And I think there are so many of us walking around out there with this combination of symptoms, not recognizing the severity of it, and not necessarily even realizing how severe it is, and that you can do something about it.
Well, yes, 100%. I see that in my patients who are in their 30s, and we do the testing. And the testing looks for all that stuff. It looks for your inflammation levels, it looks at your blood sugars, it looks at different markers that tell you how healthy your heart is. And some people in their 30s, I show them that they're at risk for metabolic syndrome, and they had no idea. So it starts early too. A lot of this stuff starts when we're young, and we just don't have the full-blown symptoms till we get around 40, because that's when they say everything falls apart, right? It doesn't have to, but that's when we start to have these symptoms. But it starts way before the symptoms become apparent.
And that's exactly what happened to me. And I was going to my doctor with all of these markers, and it wasn't, everything looked like it was maybe a little elevated, but it was within normal limits. I just kept hearing for 10 years, within normal limits. Well, I'm having problems with my body. Something is not within normal limits.
Right.
And then eventually I came to you, was so fortunate enough to have you do all the testing and lay it out in front of me and say, you have metabolic syndrome. And if you do not reverse this, your lifespan is likely to be shortened, and your quality of life is likely to suffer, like my mother's did. She passed away in mid-60s with multiple amputations and just wheelchair bound, just very, very challenged, no quality of life for the last 10 to 15 years. And you basically said that to me. You're walking in the steps of your mother, but it doesn't have to be that way. You can control that. There's something we can do about it.
Yeah, there's a lot that can be done about that. But the first step is knowing. Is really getting a baseline, like we've talked about before, going into a doctor who's going to run those tests to look and see where you need that support. But it's pretty simple. Metabolic syndrome is going to create a pretty poor quality of life, and over time that's going to become very expensive for most people, and just not fun for the rest of the family. So you've made those changes and reversed that, which is totally reversible. It's a lifestyle disease, really. Is what it comes down to.
It is. It is.
It's all about a lifestyle. Most diseases are. Most of them are, unless were born with some strange genetic disorder. Most diseases are lifestyle based.
But yet, in our society, we oftentimes feel so powerless. Like, oh, I have metabolic syndrome. I'm probably going to get diabetes.
Yeah,
I just remember feeling that way.
Sure. And if it's in your genes, like it was with your family, then you feel kind of powerless. Like, well, I guess this is my fate too.
Yes, because my mother died from it. Her mother died from it. Her mother's mother died from it. My uncle had a kidney transplant from it, and and my brother has it. My sister has it. Like, 2 sisters have it. So, and there is something genetically there, obviously. So it's not like I can just choose to wake up tomorrow and not be a diabetic anymore, right? I mean, there is a genetic component there, so we're not suggesting that at all. But we can make changes in our lifestyle that can decrease the negative outcome.
Right. Yeah. And that kind of goes back to like the study of epigenetics versus genetics. Genetics we're kind of born with a set of genes, and here's how they may or may not express themselves. But what they found is the study of epigenetics, which is basically what goes on to your genes, the lifestyle and the environment that you live in, will basically be the deciding factor on whether or not those genes express themselves. So that's why you can feel more powerful, because you've made those changes in your lifestyle and you've turned off certain genes. That's what the study of epigenetics says, is you can turn on or off genes based on how you live.
Wow.
Which is incredible.
That is.
Which is a much more powerful way to live your life.
Yes.
You're much more in control than we realize.
Yes, just being educated. One of the things that I notice in coaching is that people who start researching, and I say this a lot, but if you start researching something, you're probably getting ready to take action.
Yeah,
and
sure.
I just know when I started coming to you, I started researching and I started gaining more knowledge, and I was able to adapt to some of the research, that I had studied. I know with me, I have a certain body type. My husband has a certain body type. My mother did. And for whatever reason, that seemed to make us more susceptible to metabolic syndrome. I don't know. I don't know if the cart comes before the horse.
Sure. Yeah, that's a good question. I'm not sure either. There's a study of body types, and certain body types are more prone to be connected with a certain disorder of organs or glands. So the apple body type, which is more about the weight being contained in the abdomen, which men or women can have that. That's usually more of an insulin issue, which goes along with diabetes and blood sugar, which is what you had struggled with.
Yes.
There's the pear body type, which is a little different. That's where we put most of our weight around the hips, the lower section. And that one can be more correlated back to thyroid. Again, this is just a certain, there's not definitive studies on this. It's just what doctors have noticed. So that can be more definitive of a thyroid condition. There's also, if women have rings around their neck, like if you ever notice, I look at these things because I'm a practitioner. So when I meet with somebody, I'm looking at all these things that could help me pinpoint a certain, whatever the patient's going through, a certain diagnosis. But the rings, if you notice people who have rings around their neck, that's another indicator of thyroid condition. So just little things to kind of look at.
What about the eyebrows?
Yeah.
Because I had thyroid issues and my eyebrows stopped about right there.
Yeah.
They're a little fuller now, but not much.
Yeah.
I don't know if that ever goes back to normal.
I haven't. It's hard. It's a hard one, but the outer third of the eyebrow kind of can start to wither away as well.
I woke up one day and thought somebody shaved my eyebrows off. No, it wasn't that obvious, but I did, and my daughter noticed that. And I was like, what?
Yeah, and thinning of, like, women that have thinning of the hair, which can be a lot of different things, but you kind of look at all of it together and you can say, like, oh, okay, this person really looks like they're dealing with blood sugar, or this person really needs some thyroid tests, or, you know, other types of things. So those are just a couple of things that I look at.
Yeah, I remember my husband saying to me, "Are you losing hair?" Because he kept picking a lot of hair out of the drain.
Oh,
and
yeah.
and I was losing hair. I was thinning out a lot. So, just those symptoms. If you are struggling with any of the symptoms that we've mentioned today, I want to challenge you. Talk to someone about it so that you can establish a baseline. Like Dr. Keough, we did another video on conventional
Versus the
functional health medicine. So I want to challenge you to meet with a professional, establish your baseline by having proper testing done.
Yeah.
And if you'd like to contact Dr. Keough, her contact information will be in the description of the video. What's your phone number?
My phone number is 636-244-4994. Can I just make one quick mention?
Yeah.
I just want to mention to the people who are in St. Louis watching this, St. Louis is a great area for functional medicine doctors. There are so many functional medicine doctors in our area, and we all do something a little bit different. So we all kind of work and refer together. So if you're in the St. Louis area, you're really in good shape. So you won't have any trouble finding somebody here.
Great.
Well, important.
I live in Jefferson County, and I actually drive an hour to see Dr. Keough because, well, you changed my life and saved my life, and I'm always going to go to you. So, and I, really appreciate you. But I know you have, referred patients to other individuals too that you thought would be equipped to help them. So I appreciate the referral system that you all honor as well. So,
Awesome.
okay. Well, thank you for joining us.
Thank you.
We'll see you next time.